Hello, I am Dr. Vyakarnam Nageshwar. Today we are going to talk about something very important but often missed. We see a lot of patients coming and telling, Doctor, when I sleep in the night, I get sudden choking, I get up, I cough and I turn towards one side. Doctor, when I get up in the morning, there's a dryness of the mouth. There's also cramps on my legs. I feel little irritated in the morning, in spite of my partner telling that I slept very well with snoring. I'm not able to do the work which I really wanted to do or previously was able to do. I see a drastic change in my focus and concentration. All these things, when they enter the office, they also observe that in a meeting when everything is going on and they're silent, they're supposed to listen. They're just nodding their head and suddenly they doze off. They're driving a car and suddenly they feel that they're feeling sleepy. They don't know and they just slip off. Now, all these things keep happening. Or they're reading a newspaper in front of the TV and something is going on, everything is calm and they just sleep off. Now, all these things were there previously, but now we are observing in more numbers. Now, when we talk about such a kind of conditions, we need to understand that this is a patient who is trying to say that there is something seriously wrong with his sleep. The partner or the person with him in the room feels that he is snoring a lot and is sleeping in the deep sleep. He is not able to understand what is happening. Let us try to discuss in short what is happening exactly and what are the things that to be done. Number one, what happens is this is a condition called as obstructive sleep apnea syndrome. When we talk about obstructive sleep apnea syndrome, there is an estimate that around 40 to 50% of the population are silently suffering with such a kind of condition without having even the minimal knowledge of its condition, like this is a disease or its complication, wherein which they don't understand where it is heading towards. This condition, as I told you, is called as obstructive sleep apnea syndrome, Garate ki bimari. Now, what happens here in a normal human physiology, when I'm standing like this and I'm talking to you, I really don't know how many number of breathing, inhalation, exhalation I'm going to take. I've been talking to you for the past 2-3 minutes. I really don't know, I don't count. It's a natural phenomena. This is naturally everywhere, it is common. But when I try to lie down, when I'm standing like this, things are perfect. When I lie down on my back, there are things which are happening grade by grade, step by step. Number one, in people with snoring, when they lie down, there's something called uvula. It's called the which is above the major tongue. Now that uvula forces back to the posterior pharyngeal wall or it falls back. Now there's an obstruction of the upper, you can call it upper airways or you can call it upper part of the throat. Now when there's an obstruction at this level, the air which we breathe goes through the nostrils till this level and it doesn't enter to the lungs. When the air doesn't enter to the lungs, it doesn't allow the oxygen also to go inside the lungs. When the air inside the lungs is devoid of the oxygen, the same air is mixed with the blood in the lungs and reaches the heart. When the heart is getting such a kind of blood with low oxygen, it keeps pumping the blood which reaches the entire part of the body, including the brain. Now, when such a kind of low oxygen of blood, low oxygen in the blood reaches the brain, which we call typically as hypoxia, brain tries to adjust. After some time, it says, Baba, there's something seriously wrong. The quality of oxygen which is supposed to be there in the blood, I'm not able to get it. Now, what is the problem? Brain sends the signals. Try to identify what exactly is happening. All this is unaware. The person is deep sleep. He is not knowing. The brain is understanding what is the wrong thing which is going on. Now, immediately it senses that there is an obstruction in the upper part of the throat and it says, Baba, open your mouth and take the breathing. Now, when you open your mouth and take the breathing, natural mechanism, breathing through nose is a natural mechanism which you really don't count, you don't know. But when you try to breathe through the mouth, you suck the air inside. For a simple example, for a demonstration, you try to suck the air inside. When you try to suck the air inside, there's yet another problem which you face. For few minutes, it is going to be perfect. The air under that obstruction bypasses that obstruction and the lungs are filled with good oxygen. Now the blood in the heart is good with oxygen. Now the whole body is again getting oxygen and the brain is getting good quality of blood with oxygen. The problem here is this is a tongue. There's a famous saying, tongue has no bones but it can break bones. The problem here is the tongue is made up of muscle. The quality of the muscle is, number 1, loss of sensation in sleep. Number 2, fatigability. These are the quality. Suppose I say, this is my watch. Now I want to prove that this is muscle. I need to prove 2 things. I need to prove this quality has got a fatigability and it will lose the sensation in sleep. Suppose I am sleeping like this and somebody comes and put my hands like this. I don't know. That's the quality of the muscle. Muscle have no sensation in sleep. Tongue is made up of muscle. And in sleep, it almost goes into an unconscious state. And with the sucking of the air inside, the tongue slides back and it falls back to the posterior pharyngeal wall. Now there's obstruction number 2 in the lower part or the mid part of the throat. Now what happens next? Obstruction 1, obstruction 2. Again, the oxygen in the lungs goes down. The blood contained in the heart, oxygen levels goes down. The heart keeps pumping the blood which has low oxygen. Brain gets again the blood with low oxygen. Now this is the time when brain says, Baba, I can't take it more. It is below the critical point. The level of oxygen is dropping. I just can't hold on. I need to get him up, wake him up. Now what happens next? Brain sends signals to 2 major organs of the body. Number 1, the muscles of the back. Number 2 is the heart. Now how does it work? When the brain senses that after critical level, the level is coming down, the oxygen levels are coming down, it sends the signals to the back of the muscle and says, come on, you get up. And that's the reason when a person is sleeping like this, you cough and you turn towards one side. This coughing, turning towards one side, all these are unaware of the person, that he is unaware of the situations or developments happening. It's the brain which is acting. Now, when you cough and turn towards one side, how long a person can sleep on the same one side or lateral side entire night? You can't do that. Then again, you come back to the normal position. Then obstruction 1, obstruction 2, the same story repeats. Now, after a few hours in the sleep, brain senses there's a critical hypoxia. The level of the oxygens are still dropping. Now, it can't hold on. The second signal goes to the heart. Now, how does it react? It says, Baba, you are trying to beat around 70 to 80 times per minute. It is not enough for me. I request you to beat it more. So receiving the note from the brain, the heart, instead of pumping 80, 90 times, it starts pumping 100, 120, 130, 140, 150, 160, 180, 200, 220. What happens? Heart is made up of muscle. What is the second quality of muscle? Fatigability. When you try to jog for 1 kilometer, it's okay. When I say you jog for 10, you sweat a lot, you get exhausted. When I say you don't stop, you have been fed with good proteins, you keep jogging for around 100 kilometers without stopping. What do? At a point of a time, you just fall down. Why? Because every muscle in the body has got a fatigability. Now, heart is made up of entirely muscle. It keeps beating 80, 90, 100, 120, 140, 200, 250. At a point of a time, heart says, enough, I can't do it. It stops. Now, the sudden stopping of the heartbeat is called in medicine as sudden cardiac death syndrome. 62.8% of the people who die between 12 o'clock midnight to morning 6 o'clock die from sleep apnea syndrome. The second danger. When the normal beat is 70 to 80 times of the heartbeat, there is a pressure which is built up in the pipes, the blood vessels, which reaches the brain or other organs. It is okay with the beat and the pipe pressure. But when the pressure is increased due to the increased beating of the heart, what happens? The pressure keep on mounting. And at a critical point of a time, small blood vessels supplying the brain, they just break up because they can't hold more pressure and they start bleeding in the brain. And this is called as cerebral stroke. The area which is bleeding, that area is affected. If it is hand, you get paralysis. If it is tongue, you get paralysis of the tongue. That is what we say. 50% of the patients with cerebral stroke paralysis suffer from sleep apnea syndrome. Now, how do you come out of it? There's yet another risk here. What is that? First point is sudden cardiac death syndrome. Second point is cerebral stroke paralysis. Third, a lot of people think that the brain is sleeping very well in the night. They get up in the morning, they go to the office, they try to take up the work or the job or the laptop or the newspaper, and the brain says, Baba, whole night I was not having good oxygen, I didn't sleep. Now you are standing or sitting in an erect position, I want to sleep. That's the reason they want to concentrate in the classroom, in a meeting or in a driving or anywhere. They just slip off. Then when they slip off to sleep, the brain wants to sleep. That's the indication. Now that's a dangerous thing. If I'm a pilot, Boeing, flying at a height of 34,000 feet. Now I'm suffering with sleep apnea syndrome. What happens? I'm a pilot. Almost 400 people are there on board. I sleep off. And you know what happens? I'm driving on a highway with a speed of 120 kilometers per hour. There are passengers behind. I sleep off because I have undiagnosed sleep apnea syndrome. What happens? You know what happens? It's so risky. It's so dangerous. There's yet another important aspect. All those persons suffering with diabetes, hypertension, liver disorders, thyroid problems, they are struggling to keep their levels normal, but the levels doesn't come to normal. You know why? All these enzymes, all these chemicals are controlled by brain. It is the brain which decides, oh, he suffers with diabetes, so how much of insulin should come next day? Oh, he suffers with this kind of thing. What is the thyroxine I should release next day? Is decided by the brain. It's simple. Suppose you go to a shopping mall where 300 employees are there, and the owner says, 9 o'clock the shop closes. 9 o'clock shop closes for the customers, not for the shop locking up. After the customers go away, the owner along with the supervisors sit there and try to see what are the arrangement of the racks and empty racks see, and that times he starts telling, go to rack number 10, rack number 20, rack number 100, fill up that for the next day operations. Now that's how the brain works. Oh, for tomorrow I should see how much of gastric juice has to be produced. For tomorrow, thyroxine, how much is required. Tomorrow, how much of insulin is required. Who decides in the night? Brain decides in the night. But we have not allowed that to do. So what happens? All the levels gets disturbed in spite of the regular medications. Now, these are the things which are very, very dangerous. As the age increases, the cardiac problems increases, the snoring increases, and if you are not able to control it, it may cause a fatal injury to the life. Now, one important thing, how do you diagnose it? Very simple. You just need to go for a polysomnography, a simple sleep study. It doesn't hurt you in any way. It's just like an ECG that you just keep the leads in an overnight, and it records your brain, your eyes, your muscle, your nerves, everything. And next day morning you get a data. Based on the data, we take a decision. What is the real condition of your sleep apnea syndrome? Based on that, we try to suggest you the modification. The standard, global standard of the treatment is auto CPAP therapy. It's a simple positive pressure ventilation which is pretty comfortable, which saves your life. So I wish you understand the importance of it. I wish you try to take action on yourself if at all you're suffering, or the loved ones. Thank you for watching.